You gotta smile.
All right, so just sit with a smile on your face. In about 10 seconds, just take it away. You're good.
Okay. So today's presentation is about the initial visit at the pediatric dental office. I know a lot of parents have questions, sometimes even anxiety of the first dental visit for infant and toddler, ages 1 to 3. They wonder what's going to happen. They wonder, how things are going to go. Is it scary? Does the patient have to sit in the chair? And so on and so forth. So our job today is to make sure that, everyone has an idea how simple an exam for an infant and toddler will be at the pediatric dental office. The first thing we do, the patient comes in, the parent comes in, and we go over a couple of questions. First being the past medical history, which is any illnesses, any sicknesses, any medications, anything like that, which would adjust, or we would have to adjust to make special accommodations. And if there are any illnesses, we will make those special accommodations. Then secondly, we'll move on to the past dental history, which is, have they been to the dentist before? They probably haven't if it's their first visit and they're an infant or a toddler. And if so, what happened at the initial visit? What was done? What did they like? What didn't they like? And then if that's all clear and it's a regular checkup, we move on to actual dental treatment and dental cleanings and things like that. So we go over how to brush, what to use. So a lot of parents have questions on, okay, when should I start brushing my child's teeth? And that answer is simple. As soon as the first tooth erupts into through the gums, and you brush. And then the second question is, do I use toothpaste with fluoride or without fluoride? And the answer is to use always toothpaste with fluoride in it. That's very important. Toothpaste with fluoride. The safe to swallow is training toothpaste. I would put it on when the kid's teeth aren't erupted yet. Rub it around the gums, let them get used to it. But it has no effect on actual decreasing the chances of getting cavities on the teeth. So definitely you put the fluoride toothpaste on and you use a little smear layer of the toothpaste. I will demonstrate that. I'll get some toothpaste out and I will show just how much. I don't know if they'll be able to see on the camera, but I'll do it and I'll open it and I will put this over here. And just a little smear. You don't need a pea-sized amount for an infant to toddler. Just a little smear. Just a little tiny bit. Okay? And then we will go over how many times a day to brush the teeth. And that is actually 2 times a day, once in the morning, and then once before bed. Okay? And once we go over the brushing and all of that, the next step is diet. Are they using a pacifier? Are they still using the bottle? Are they using the sippy cup? All of which can damage the teeth if used incorrectly. So the biggest thing is the bottle and sleeping with the bottle at night with juice or soda or chocolate milk overnight. That destroys the teeth, and actually I see kids with rampant caries, rampant cavities, 10 cavities when you do that. If the child likes to go to bed with the bottle, water in the bottle only. As far as another thing with the diet is fruit snacks and juices and other things labeled as natural, made with real fruit. Just read the back of the packaging and see how much sugar in it. You'll be surprised how much sugar is actually in some of those snacks labeled as healthy, and they're sticky. It's very, very, very tricky. You know, you see the package, it has strawberries on the front of it or whatever, but that actually can be very, very harmful to the teeth if eaten in high quantities. So we go over the diet, you know, of course, fruit, vegetables, and things of the such are good for the teeth. You know, they can snack on, you know, Ritz crackers, wheat thins, things of that nature, and it's a lot healthier. Cheerios, things like that. So once we go over all of that, we have we go over all of this to make sure, you know, the child is sitting and quiet, and we go over that so there's no interruptions. But now we move on to the exam part, and this is, I guess, the part that everyone is interested in is the exam to see, okay, Dr. Young, how are you going to get in my child's mouth? I can barely do it, and I don't think he's going to sit in the dental chair, and so on and so forth. The thing is, they won't have to sit in a dental chair. They sit on the parent's lap or guardian's lap, whoever brings them in, the adult, and it's very simple. So we're going to demonstrate that today using our little cushion here, it's a little chair, and Yulissa, my sister, is going to help me. Smile for the camera. All right, and we're going to use our little doll here. Her name is CO. That's what my daughter named her. She let me bring her, so I'm safe at home. Okay, and this is how you're going to position. She's going to actually lay one leg around the waist and lay back, and then you hold the hands just like such, and just like this, plain and simple. No, you know, struggling too much and no crying. And if they do cry, that's excellent because the mouth is open. But it's a simple exam. Nothing hurts. So then, you know, you can see the comfort of the parent or guardian's here. I'm here looking at everything, and this is how it is done. Now we're going to demonstrate because CO doesn't have any teeth, so we want to use our other doll here, which is BG Roo here, and he has teeth. Yeah, we're going to switch, and this one has teeth, so I'm going to just demonstrate here how simple the exam is. Okay, so if the child infant is crying, that's good because the mouth is open like this. I have a little mirror, and they're singing for me, and I can hear everything, but I can see everything because they're singing here. We just look around while they're singing, make sure everything's good. And again, everything is safe, the comfort of the parent, and I am just taking a look, and we're going and make sure everything is okay. And as you see, BG Roo is fine and intact and no problems. Okay? All right. And then we go around, we count the teeth, and we'll let you know if we see anything with the gums, we see anything on the teeth, but it's very simple and plain and no issues. And now what we're going to do is go around, like I said, we're going to go around, look at the teeth, and then we're going to count the teeth with our little tooth instrument here, and it's usually anywhere from 8 to 20 teeth, depending on how old the child is. And you go 1, 2, 3, 4, 5, like that. Very simple. Once that is complete, we brush the teeth. Again, simple toothbrush, no hand pieces, no drills, no, you know, things of that nature. And we brush the teeth, go around with the little toothbrush, plain and simple. Okay, and then lastly, we have the fluoride varnish, which is the most important part of the appointment because this is the fluoride we put on to protect the teeth to keep them strong until the next visit in 6 months to protect the teeth against cavities. And we put it in there, and again, it's just a little toothbrush, like a fingernail polish brush, and we brush it on the teeth like so. And again, BG Roo is fine, no problems, everything's good. And you can pick BG Roo up and take the little, and afterwards, if there are problems, we'll go over how to manage those problems and take care of it. And if there are any questions, anything further, we'll answer those questions. But that's the simple and easy way that an infant and toddler that is fearful and won't sit in the chair is examined in a pediatric dental office.
You're gonna be glad you did this, trust me. Oh my God, it's so loud.
Wow.
Oh, this is awfully loud. Oh God. I'm not sure if I'm turning it in the right order. I must be doing something wrong. This one doesn't even have a marking on it. Because if he comes out that loud, then it will pick up. Wait a minute, it's too loud. Okay, try again. Okay, yes, that's better, yes. Okay, we're ready. Good evening, and welcome to 21st Century Conversations. Our conversation this evening is about oral health, the importance of good oral health. Our mouth is the entry to our body and to health and well-being. And with me this evening, we have three dentists who are going to tell you just how important good oral health really is. And they are Dr. Michael Weiner. Tell us a little about you.
I'm a periodontist. My office is in West Haven, Connecticut, and I've been practicing about 15 years in the greater New Haven area.
And your office is called Connecticut Dental Associates?
It's Connecticut Dental Associates. This particular office opened about 4 years ago with the vision of creating access for care for the Medicaid community in New Haven.
Yes, and we know that you serve a broad cross-section of people.
Yes.
And we'll talk a little more about that. Dr. Maria Jimenez, welcome. Tell us a little about you.
I have a dental practice in New Haven. The name of the practice is Albania Dental. It's a general practice, but we do ortho, or what the people know better as braces. And I've been in practice for around 12 years. Mm-hmm. Basically, that's what we do. A little bit of everything: endo, crowns.
Okay, and you mean endodontics?
Endodontics.
Yes,
mm-hmm.
And we will come back and you will tell people exactly what that is.
Okay.
Okay?
Mm-hmm.
And welcome to the table. And Dr. Darnell Young.
Hello, hello. I am, of course, my name is Dr. Darnell Young. I work at Elm Family Dental in West Haven, Connecticut. I am a pediatric dentist, so I see the little guys. And
Yes.
I've been at Elm Family Dental for 5 years now.
I see.
Yeah.
And welcome to you. Now, we're going to ask Dr. Weiner to tell us more specifically about what exactly is periodontal dentistry and why it is so critically important to health and well-being, not just to your teeth, but to your total body. So can you tell us some more specifically about periodontics?
Well, periodontal therapy is to treat the attachment apparatus of the tooth, basically the foundation of the teeth. But what's important to understand, and the research and the literature it's becoming in every journal. And I brought this evening a copy of the latest Journal of Periodontology, which is the official publication of the American Academy of Periodontology. Mm-hmm. And the first 4 articles in this month's journal is all about the connection between oral health and systemic health. The first article is the connection of obesity and periodontal disease. The second article is about C-reactive proteins, which are markers for heart attacks. And the treatment of periodontics will bring down the level of CRPs. The third article is about women who are pregnant and low birth weight babies. So this really stresses what's going on now in the research, in the literature, how important it is to treat periodontics, because this is, we know now that there is a great connection between oral health and systemic health.
Tell us a little about the connection between periodontic disease and obesity.
Well, the article here shows that there is an increased amount of periodontal disease with obese patients, and they were, in the article also goes on to discuss gastric bypass, whether that's going to help in the treatment of periodontology.
I see. Dr. James, can we see that graph you have there? Does it show us anything that would be related?
Well, this is a picture of a healthy tooth and the healthy apparatus.
Yes. Can we get a close shot of that, guys? Hold it up a little more for us. Yes. Okay.
Okay. So basically, what this shows is the bone, the attachment apparatus of the tooth, the bone, the periodontal ligament, the gingiva, and the tooth itself. And this shows a healthy state of a tooth.
Okay. Yes. Okay. And so what happens when how do you know when you look at that, so that's a healthy tooth?
Correct.
Now, what happens when periodontal disease starts to show up?
The mouth is basically a dark, warm, moist, place for bacteria to colonize and bacteria to do their damage. So the first thing that usually happens is gingivitis. Gingivitis, you're going to see bleeding gums. The patients may have a bad taste in their mouth, and this is detected if patients come in regularly, or if a patient notices they have bleeding gums. That prompts them to call the dentist, and they'll come in, and a full diagnosis will be made of what state, what level of disease they could be in. And once the diagnosis is made, then we could create a treatment plan that will treat their periodontitis.
Okay, now you said there's also connection between heart disease and periodontal disease, and what's that connection?
Well, right now, this article is showing that the C-reactive proteins are markers that are increased, that are high levels when someone is having a heart attack. So, and the gum treatment will bring those levels down. So it's very important to keep your mouth healthy. The inflammation, you don't want any inflammation in your mouth.
Okay, but how would someone know if these proteins are high? If I don't have pain in my arm or pain in my chest, how would I know that these proteins are high, that I should get my teeth checked?
These levels will be made with a blood test. But the research is showing that if you treat your gum disease, you're going to lower the levels.
I see. So that's why it is important to get your teeth cleaned regularly,
Absolutely.
even if you don't have any pains in your chest or anything.
Absolutely.
Okay. What else should we know about periodontal disease before we...
Well, periodontal disease, there's also a great connection between gum disease and diabetes. And people that control their diabetes, or they're uncontrolled, if they treat their gum disease, their blood sugars will run at a better level, a healthier level.
Really?
Yes.
Wow. What's the relationship between blood sugar and gum disease?
Well, we know that people who have diabetes, they have their wound healing potential goes down.
Yes.
And basically, gum disease, periodontitis, is an infection. So if you're able to decrease the amount of the body's fighting, so you're going to have a better, healthier body.
And when someone comes here, this is my last question about this segment. When someone comes to you with receding gums, for example, what do you do for that person?
Receding gums,
or inflamed gums, whichever one is most visible as a sign of periodontal disease.
Well, again, we would see if it's just gingivitis. Is it just affecting the gingiva, or is it already into the bone? That's periodontitis. The difference between gingivitis and periodontitis means it's already gone into the bone. So you can't just treat it one way, because you have to understand the state and the level of the disease. Once we're able to make that diagnosis, then we could create a treatment plan and treat that level of disease. And that would be done in different ways, and we could talk about that.
Okay. Well, thank you very much for that very concise bit of information. And now we're going to open up our discussion. And Dr. Young, we're going to start with you because you start with the little ones.
Yes, yes.
Tell us how important is it that parents take small children, and many people think that you're going to lose your baby teeth, so there's no need to pay specific attention to them. Is that correct?
Well, it's the notion that the teeth are just going to fall out anyway. That's a misnomer. A very common one, though. It's very important to bring your child to the dentist and make sure that pediatric dentist, to make sure that there are no problems with the baby teeth. Not only to address to instill good oral hygiene habits, but also if you let the teeth just decay and have no care for them, what will happen is the adult teeth will become affected, and that can really start something downhill before even the adult teeth are in the mouth. Very important to keep oral hygiene and the habits of oral hygiene and instill those in the little ones. I know a lot of times, like I said, the people think that, okay, they're going to fall out, the teeth are going to come out. Why do I need to brush them? But it can actually affect the teeth. And actually, a lot of missed days at school is due to poor oral hygiene, teeth getting infected, and things of that matter.
Okay, I want to backtrack a little because you have, in preparing for this program, I understand that you have special training in dealing with children with special needs and with a specific type of pediatric dentistry. Tell us, what does it mean by you have special training in dealing with children with special needs?
Well, there are tons of special need. The spectrum of special needs there's a lot of categories that fall within that spectrum. The most, like you have children with common things such as asthma that you have to make special accommodations for. You have things such as Down syndrome, so it all depends. But the training is, to have the accommodations to treat these children, whether it's behavioral, whether it's communication-wise, or just have the facilities to sedation if they're apprehensive, and things of that nature.
Yeah, I noticed also said that you have oral conscious sedation training. What is, to us, that's just a bunch of fancy words. What does that mean in practicality?
Okay, what that is actually, it's training where, you got children, they're apprehensive. Some of them, are special needs and won't sit for your routine, filling or things of that nature.
So do you sedate them?
Yes, we sedate them. We give them medicines that calm them down. Very safe, very common within our realm of things here in our specialty. And it makes the appointment a lot easier, and it's very effective. The days of holding someone down and doing dentistry and, one grab the legs, the other grab the arms, that's kind of coming to an end, and we're using the
Well, I'll tell you, there are many adults who are probably more anxious going to the dentist. So, Dr. Jimenez and Dr. Weiner, do you have any special way of calming down anxious adults?
Well, there's medication for adults as well, whether they're taking a Xanax or different types of...
Trisalon.
Trisalon?
Yeah.
Different types of medication.
That sounds so...
But these are very helpful.
Yeah.
Also, whether it's soft music, a special time of the day. Some people may like a morning appointment, or
Yeah, because many people are afraid to go to the dentist because they get so anxious and they don't. So for any of you, you give them Xanax?
If the need arises, or there's nitrous oxide, or there's sedation.
That's what we call laughing gas, right?
Yes.
And if
Very important.
If need be, we'll bring in an anesthesiologist.
Thank you very much.
Really?
There are dental anesthesiologists that will come to your office for IV sedation in the office.
Wow. Okay. That's
So there's all levels
Yeah.
of sedation.
Sedation.
Depending on the level of anxiety.
Yes.
And as Dr. Darnell said, a lot of these fears start,
In
in
childhood.
childhood. So
Yeah.
if we're
Yes.
able to get these kids in for good, fun visits early on, it will change them for a lifetime.
Okay, now I would like the three of you to focus for us and think that there are thousands of people across Connecticut sitting in their living rooms watching this program. And you talked about the importance of cleaning and going to the hygienist and all that. And Dr. Jimenez, you did a very special piece for us where you talk about what happens in the Latino community sometimes. But so now we're going to ask you all some more general questions.
Yes.
And we read of two very sad cases about abscess teeth in young people that led to them dying. One was a 12-year-old boy in 2007, and with an abscess tooth, whose mother could not afford the $80 to have his tooth extracted. The other was a 24-year-old man in 2011, September 2011. Here we are in the 21st century in America, and we have people dying from abscess teeth because, one, they don't have the information that tells them your life was in danger, and two, I think something is wrong with our medical system if we could turn away somebody for taking out a tooth that costs $80 because they didn't have health insurance. And I would like to get some specific information. Why are abscess teeth such a danger to the human life? We have, who wants to start?
Well, I'll start.
Okay.
The most important thing is that, it's important to know that the mouth is connected to the rest of the body. People see teeth as a separate entity. They're just used for eating and that's it, and that, and it's not connected, but it's a blood supply and it's connected to the rest of the body. And I think when people have infections, they don't realize it. Like if they had, you had a cut finger and it got infected, I think you would do something about it. But there's people with tons of untreated teeth that think, okay, it's just a tooth and I'm just gonna move on, it's not hurting today. So, but it's connected, it's all connected, and it can lead to severe problems and spread.
Now, many people believe that if a tooth is bothering you, you're going to take it out, and that's the end of the problem. Is it the end of the problem?
It's a it just make everything worse most of the time.
Okay, tell us why.
If you take one tooth out, then the whole bite is disorganized. Teeth move in the wrong directions because the teeth need support to keep, everything in harmony. So now with the endo treatment that we have now, it's really...
Define endo treatment for us.
It's endo, or we call a root canal. It's when the cavity gets into the nerve. Instead of just taking the tooth out.
So you have, show us again, where is the nerve in the tooth?
This is the blood supply. Here is a blood, nerve, and arteries inside the tooth.
Okay.
Right here. So this is the enamel. This is the surface of the tooth.
I'm looking at it, yes.
And then this is the dentin. And then the cavity travels from the enamel cavity to the nerve.
I see.
When the cavity gets into the nerve, then it's infected and it starts dying. Or it gets inflamed.
Is that when you get the pain? When do you get the pain?
When this nerve get inflammation, because they inflame inside the tooth. So that's why you have so much pain from
I see.
the infection.
Now, both of these people had